Good day everyone, I'm Carissa Alvinia and today I will discuss about pulmonary hypertension. What is pulmonary hypertension? It is characterized by elevated pulmonary arterial pressure and secondary heart ventricular failure. Or to simply define, it is the increased blood pressure in the pulmonary circulation. Understanding the physiology and pathophysiology of pulmonary circulation is critical in the diagnosis and management of pulmonary hypertension. To trace back the flow of the blood, it starts in the right ventricle, which receives the oxygenated blood and pumps it to the pulmonary arteries. The blood then travels to the lungs to be oxygenated and onto the left atrium. From there, the oxygenated blood moves into the left ventricle, which pumps blood to the rest of the body through the aorta. This is the comparison of a normal heart without pulmonary hypertension and with pulmonary hypertension. The difference between the two is the pulmonary hypertension has this enlarged right ventricle, which termed as right ventricular hypertrophy, and constriction of pulmonary arteries. What are the causes of this condition? So these are some types of congenital heart disease, connective tissue disease, coronary artery disease, high blood pressure, liver disease, blood clots to the lungs, chronic lung diseases like emphysema and genetics. Patients are classified by the World Health Organization into 5 groups based upon the mechanism of pulmonary hypertension. So these are the 5 classifications. Group 1 is pulmonary arterial hypertension, which is idiopathic or genetic mutation. Group 2 is from left-sided heart disease, such as mitral valve disease or long-term high blood pressure. Left heart disease is the most common cause of pulmonary hypertension. Group 3 is from chronic hypoxic lung disease. This is related to lung problems like chronic obstructive pulmonary disease and interstitial lung disease, as well as sleep apnea and other sleep-related breathing disorders. Group 4 is from chronic blood clots, and Group 5 is unclear multifactorial mechanism. So this is the pathophysiology of this condition. So due to the causative factors of pulmonary hypertension, such as patients with chronic heart failure and other lung diseases, increases the risk of endothelial injury and dysfunction. So the main function of endothelial cells is to maintain or regulate the systemic blood flow and tissue perfusion through changes of vessel diameter. So if there is a malfunction of these endothelial cells, this leads to coagulation abnormalities, vasodilator and vasoconstrictor imbalance. Pulmonary vasoconstriction is susceptible individuals. In coagulation abnormalities, endothelial cells trigger fibrin formation as well as platelet adhesion and aggregation to promote coagulation that may result to thrombosis. Thrombosis is the formation of an occlusive clot within a blood vessel that reduces blood flow to distal tissue and organs, resulting in increased vascular injury with vicious cycle perpetuating pulmonary hypertension. Patients with heart and lung diseases experience pulmonary vasoconstriction that leads to increase in vascular smooth muscle and decreased flow in the pulmonary arterioles due to left ventricular dysfunction, which elevates left ventricular filling pressure, resulting in a passive increase in pulmonary venous pressure. This is known as reactive pulmonary hypertension, and this leads to damage of pulmonary vasculature and triggers the platelet endothelial cell leukocyte interaction for tissue repair, as well as the canalization of neural and obstructing fibrin clots. All these factors result in increased vascular injury with vicious cycle perpetuating pulmonary hypertension. What are the signs and symptoms of pulmonary hypertension? The symptoms of this condition during the initial stage of the disease are common to many other medical conditions, such as difficulty breathing and fatigue. This often results in a delayed diagnosis until more severe symptoms arise, such as dizziness, chest pain, ankle swelling, or palpitations. Assessment findings and diagnostic procedure. Initial diagnostic evaluation includes a history, physical examination, chest X-ray, pulmonary function studies, electrocardiogram, and echocardiogram. Echocardiography can be used to estimate the pulmonary artery systolic pressure and to assess right ventricular size, thickness, and function. It can also evaluate the right atrial size, left ventricular system, and the diastolic function, as well as valve function. Right heart catheterization is necessary to confirm the diagnosis of pulmonary hypertension and to accurately assess the hemodynamic abnormalities. Pulmonary hypertension is confirmed with a mean pulmonary arterial pressure greater than 25 mm of mercury. Left heart disease is identified via echocardiography and correlates with a degree of estimated pulmonary hypertension. Then exercise testing and both the right and left heart catheterization may be done to determine the functional severity of the disease and the abnormalities in pressures. How is pulmonary hypertension treated? So all patients with this condition should be considered for the following therapies: oxygen therapy, vasodilators, anticoagulants, diuretics, digoxin, atrial septostomy, pulmonary endarterectomy, transplantation, reduce salt intake, limit fluid intake, follow vegetable diet, do light exercises. Diuretics and oxygen should be added as needed. Appropriate oxygen therapy reverses the vasoconstriction and reduces the pH in a relatively short time. Most patients with pulmonary hypertension do not have hypoxemia at first but require supplemental oxygen with exercise. Anticoagulation should be considered for patients at risk for intrapulmonary thrombosis. Digoxin may improve right ventricular ejection fraction in some patients and may help to control heart rate. In surgical management, lung transplantation remains an option for a select group of patients with pulmonary hypertension who are refractory to medical therapy. Bilateral lung or heart-lung transplantation is a procedure of choice. Atrial septostomy may be considered for selected patients with severe disease. This procedure results in shunting of blood from the right side of the heart to the left, decreasing the strain on the right side of the heart and maintaining left ventricular output. In natural ways, experimental and clinical research revealed that natural products can ameliorate the symptoms and improve prognosis of pulmonary hypertension. Additionally, some natural products selectively improve the pulmonary circulations without affecting systemic arterial pressure or systemic arterial pressure. What are the nursing diagnoses? These are rest for decreased cardiac output related to increased vascular resistance secondary to pulmonary hypertension. Activity intolerance related to imbalance between oxygen supply and demand. Acute pain related to increased cerebral vascular pressure. Ineffective tissue perfusion related to decreased arterial blood flow. Impaired gas exchange related to increased pulmonary vascular resistance. Nursing management. The major nursing goal is to identify patients at high risk for pulmonary hypertension, such as those with COPD, pulmonary embolism, congenital heart disease, and mitral valve disease, so that early treatment can commence. The nurse must be alert for signs and symptoms, administer oxygen therapy appropriately, and instruct the patient and family about the use of home oxygen therapy. Emotional and psychosocial aspects of this disease must be addressed. Prognosis. There is currently a known cure for pulmonary hypertension, but with the help of continuous research, improvement of diagnostic techniques and therapies help to diagnose the disease earlier to manage the symptoms for longer. Left untreated, the prognosis is poor and the disease is often fatal within a few years, emphasizing the need for a quick and accurate diagnosis.